Hey everybody, it's Dan here with Pain Free You. The topic for today is that the type of treatment you receive depends on who you see. Okay? So before I dive into that topic, let's take a look at the woods, take a couple of deep breaths. Breathe in the serenity. Breathe out the chaos. Breathe in the nature. Breathe out the stress. Breathe in the comfort. Breathe out the discomfort. And feel free to keep on breathing deep breaths and relax your body. I call it forced relaxation. It's literally recognizing that our bodies are tense and we literally have to become aware of that and decide to go force our body to relax, because a tense body does not protect us at all. Anyway, so the topic for today, I just lost it. Brain fart. I literally have a note on my phone. I will find it. I just distracted myself with that whole breathing thing. Oh, the type of treatment you get depends on who you are going to see. And I bet 100 of you guys were in there going, Dan, you just said it. The type of treatment. Now go on, come on, tell us. Tell us about this. And this video is a little bit to poke a hole in the medical model, or our belief that maybe doctors really know what they're talking about and that the pain management world knows what they're talking about. Because if you're still not 100% convinced about this TMS, I hope that this video will help push you over onto the other side of the fence that says, okay, maybe this TMS thing makes more sense. It's the only thing that makes sense. So when I say the type of treatment you get depends on who you go see, here's a couple examples. You go to your general practitioner with some back pain. They'll turn you around, bend over, they'll look at your spine, like that tells us anything. And then they will say, well, back pain often resolves, so here's some muscle relaxants or maybe some pain meds. Here, let me grab my prescription pad and I'll give you some drugs. Great first step, right? If you go to a chiropractor, he's going to evaluate you. Now, he may get some x-rays done, or he will feel your spine and talk about, misalignment here, muscle imbalances there, subluxations and this and that, and then he'll start cracking your back. And for me, chiropractic was kind of cool because they would put these little stimulators on my lower back and electrocute the muscles, and that kind of really increased the blood flow and kind of loosened things up. And then I'd get a couple pops and I would walk out of the chiropractor feeling kind of better. But an hour later, pain was back. I was twisted again, and so it was a very temporary solution. So if you go to see a chiropractor, what are you going to get? Manipulation. If you go to see a GP, what are you going to get? Probably either a referral to a specialist or drugs, or both. If you go to an acupuncturist, what do you think you're going to get? Needles. If you go to a massage therapist, what do you think you're going to get? A massage. If you go to a physical therapist, what do you think you're going to get? Physical therapy, right? If you go to an orthopedic surgeon, what do you think you're going to get? Probably surgery. If you go to some other pain management people, what do you think you're going to get? Probably injections, steroidal injections and a whole variety of other things. And if you keep on going to specialist after specialist, every single person, every type of pain management expert is going to give you a different treatment. But to me, let's look at the medical model here. If you show up with presenting the same exact symptoms to 10 different specialists, how can the medical system offer you 10 different recommended cures? It just doesn't make sense. To me, that's just evidence that they don't understand the cause, and they are simply saying, well, let me pull out my textbook. This is what I was taught about your condition, so I am going to apply my treatment to your condition. And now, don't get me wrong. TMS is applying the same treatment to your condition too. The difference is success. So many people are getting better from TMS work. and the TMS approach and the mind-body approach and believing that our bodies are already well, when in fact these pain management specialists, it's almost like their whole business is to just keep giving you these temporary treatments. I mean, literally, you get an injection in your spine, they tell you this will only help for a month or two. And then what? You got to come back. We'll give you more injections. All right, so it's clearly not a cure. So it fascinates me that you can show up with one set of symptoms to 8 or 10 different specialists and get 8 or 10 different treatments. To me, that really just is evidence that they don't really understand the core original cause of the pain. They are just simply applying what they've learned in school. And, to their credit, a lot of them are frustrated because they believe they're helping, but probably in their heart they realize that it's temporary. It's not a fix. And so when we really look at the cause of chronic pain and other symptoms, stress illness, we realize that it's the body just getting a little wonky and weird and out of whack because of some misprogramming about emotions and their safety or their lack of safety, that they're dangerous. And again, go back to the knowledge of TMS. Read a Sarno book, read Steve Ozanich's book, read Nicole Sachs' book, read a book by Dr. Schubner, Dr. Hanscomb, Dr. David Clark. These guys are great. All their books really kind of lock in the fact that there's almost never, well, there is, but very, very small percentage of people have a true structural problem. But again, if you go to a structural mechanical doctor or pain management person, what do you think they're going to tell you? It's structural, because they don't understand TMS, they don't understand the mind-body connection, they don't understand stress illness, and even if you present it to them, they'll look at it and kind of cast it aside. I literally, while I was doing 6 weeks of physical therapy, I gave them the audio disc for Dr. Sarno's Healing Back Pain. I said, hey, give this a listen, I want to know what you think. 3 weeks later, they never even cracked the disc. It was still sitting on the front desk of the office. So it was at that point that I really needed to fire my physical therapist. So again, I respect and love doctors and pain specialists. I just think they don't know what they don't know. And I'm not saying I'm the expert and I'm like, I know more than them and I'm better than doctors. It's none of that crap. But it's truly fascinating that you can take the same symptom, go to 8 or 10 different pain specialists and get 8 or 10 different treatments and approaches. And if you look at it, the treatment they apply is what they were taught in school. And so it's nothing more than that. And so if you think going, you've been to 3 specialists, and if you think going to a 4th specialist, a different kind, is going to be the answer, well, those things didn't work, so maybe this or that physical treatment will work. I don't think that's going to work for you. And I'm not saying that to dismiss any of those procedures or processes or treatments, but look at your own history. How well have the physical treatments worked? And by the way, for those people who are diving into the TMS work and they're still going to physical therapists and they're still going to acupuncture people and they're still going to deep tissue massage and all this stuff, Sarno said you're just going to confuse the brain if you try to treat it with a mind-body approach but also still treat it physically, because the brain is going to latch onto the fact that you still believe it's physical and it's not going to let go of the pain because it still believes you're broken physically, and therefore it will send the danger alarm when you move physically. Does that make sense? So please, if you've tried 6 specialists, feel free to try 7, 8, 9, and 10, but just understand the type of treatment they're going to recommend is from a textbook, and it's not from a true understanding as to what this stress illness and this TMS, too much stress, and mind-body syndrome and PPD and They just don't understand it. So you're going to keep on getting the type of treatment that those people have studied and gone to school for. And again, it just, to me, proves that if medicine were so on target with pain management, if you present with one symptom, there should be one solution, right? In the TMS world, there is one solution. Feel your emotions, soothe yourself, learn that your body is fine, and don't worry about it. I mean, that is the solution. You got to get there through knowledge. You got to get there through assessing whether or not your pain is TMS or not. But then the cure is the same, regardless of how your symptom shows up. It's really fascinating. So in the stress illness world, the solution is very consistent, whether you go to a variety of different TMS, experts or coaches or doctors even. The solution is generally the same. Know that you're fine. Turn down the volume on your stress. Soothe your nervous system. Soothe your thinking, which turns on the stress response. Know that your body's fine and really put your focus elsewhere. That's pretty darn consistent across all of the TMS coaches and experts out there. But it's not consistent when you go from doctor to doctor to doctor. You'll hear different things from different doctors and different pain management people. So I think it's pretty fascinating that, again, the type of treatment you receive depends on the type of specialist you go to. And I want you to just start questioning that if you're still in that medical model and in that medical world of trying to treat your symptoms physically, because in my mind that just doesn't make sense. So with that, I'm going to wrap this video up. I appreciate you guys and gals. I will talk to you in the next video. Love you. Bye.